Hi, my name is Rachel Davis. Here's my student badge. And I will do a quick view of the room. No TVs are on. There's my patient. No laptops are open. All right. Okay, and then here are my tools. All right. Okay. Hello. Today we're going to be doing an ears, eyes, nose, and throat exam. So I'm going to start with the eyes. Do you wear glasses just for reading?
Yes.
Okay, I'll take those off. All right, and first I'm going to have you close one eye.
Like this?
And, yep,
Okay.
and read the smallest line that you can.
DHJBS.
All right, and then can you cover your other eye and read the smallest line that you can?
OLCF.
All right, and then open both eyes and read the smallest line that you can.
Probably DHJBS.
Okay, great. And that would, your vision would be about a 20/40.
Okay.
All right.
Is that good?
It could be better. All right, and then I am going to do a visual field exam, so that's where I'm going to wiggle my fingers, and I just want you to let me know when you see them come into your vision, okay?
Okay.
All right.
Now. Now.
Okay.
Now.
All right, and now I want you to cover one eye. All right, I covered the same eye.
Okay.
And let me know when you see my fingers.
Now.
Okay, and then cover your other eye. Let me know when you see my fingers.
Now.
All right, very good. That's no abnormalities. And then I'm just gonna inspect your eyes.
Okay.
I'm just taking a peek. All right, and then I'm gonna pull down your lower lids, okay? All right, can you look up and look down and look to the left and look to the right? All right, no abnormalities are seen there. No swelling or redness in your eyes. And then I'm going to use a light and I want you to look straight ahead.
Okay.
And I'm just looking at your corneas and lenses. All right, and I'm gonna come and look on the other side. Very good. And then I'm gonna check your pupils.
Okay.
So just look straight ahead. All right, and your pupils are equal and reactive to light, so that's a normal finding. And then I just want you to, I'm gonna step back just a little bit, and I just want you to look directly at my light, okay?
Okay.
I'm just checking your corneal reflex. All right, and that is all normal. Let me turn off this light.
I'm seeing spots.
I know, I'm sorry. And then this is called a cover uncover test. So I'm just going to cover one eye. I just want you to look at the wall.
Okay.
I'm just checking for deviation, basically like a lazy eye, lid lag. Which all of that's normal. You don't have any strabismus or nystagmus, all these fun words. Now I get to really look at your eye. Maybe if I can get this on there. Okay. All right. So I have to get a little close and personal for this one.
Okay.
So, I'm just gonna put my finger up here, okay? And I just want you to look over my shoulder,
Okay.
basically. And I'm going to take a look. All right, very quiet. And then look on this side. Open your eyes as well. Sorry, sorry, that's burning your eyes a little.
No, it's fine.
So I'm just looking at the retina and the optic disc. So I was able to visualize both of those, and the optic disc is like a creamy yellow, which is normal. And all of your arteries and veins looked good. There's no like swelling or lesions that are concerning. So we're gonna move on to your ears. Okay. Boy, this thing is giving me a run for my money. All right. So first of all, I'm just gonna look at your ears. Sorry. And I'm just gonna palpate. Do you have any tenderness?
No.
And then there's no bumps or lesions or concerns on my end. And then I'm going to this little doodad on there. Make sure it's in there really well. And turn on my light. And I'm just going to pull the ear up and back a little bit. I'm just looking in the ear canal to make sure everything looks good. And then I'm going to go in a little deeper, okay?
Okay.
And I'm just looking for your tympanic membrane.
Did you find an elephant in there?
No. I'm just taking a peek. Everything looks good. There's no discharge or swelling or redness. I'm gonna lift that up a little bit. I'm going just a little deeper. And I'm able to visualize the tympanic membrane, which is a pearly gray.
Okay.
There's no swelling or redness, so that's good. And then got my trusty tuning fork here, so I'm gonna hit it on my hand, it vibrates, I'm gonna put it on your head. It's called the Weber test. Just let me know if you hear the vibrations equally on both sides, or if you hear it more on one side over the other.
Okay.
Do you hear it like on both sides equally?
Yes, yeah.
Okay. All right, and then this time I'm gonna put it behind your ear. It's called the Ren test.
All right.
And let me know if you can hear it. And let me know when you no longer hear it.
Okay, it stopped.
Can you hear it now?
Yes.
Okay. And do the same thing on this side. Can you hear it? Let me know when you no longer hear it.
Okay, it's gone.
You
I can hear it, yeah.
Okay. Now I'm gonna do a whisper test. So I want you to close that ear just with your hand, like your
This one?
finger. Yep, let's plug it. I'm gonna whisper a word and you just let me know what I'm saying, okay?
Coffee.
Yes. And I'll come on this side and do the same thing. We'll cover that ear. All right, I'm gonna say
I didn't make that out. Table.
yes. Very good. All right, and then I'm gonna check your, I think that was it for hearing. So now I'm gonna move on to your nose, actually.
Okay.
I'm just gonna take a look. Everything looks normal and symmetrical. I'm just gonna feel, okay? Do you have any tenderness?
No.
Okay. And then I'll change this out for a new one. I'm just gonna take a look inside your nose.
Okay.
Oh, do me a favor first. Close one side and take a deep breath in. All right, and then do your other side. All right, everything sounds patent,
Yeah.
about as much as it can for a fall. All right, and then I'm just going to lift your nose up a little bit.
Okay.
Okay, and we'll look on this side. Maybe I come on this side to do that. All right, everything looks good. I don't notice any like deviated septum, polyps. You have just like normal clear drainage, so nothing concerning there. And then I'm gonna check your sinuses.
Okay.
So these are your frontal sinuses. Let me know if you feel any tenderness when I'm pressing on them.
No.
All right, and then your maxillary sinuses.
No, feels good.
Like a little massage.
Yeah, a little massage.
All right, and then next we're gonna move on to your mouth. So, my little tongue blade.
Okay.
So lips look good, they're not cracked.
Okay.
Can turn on my light again. Might as well just leave the thing on the whole time. I'm gonna use my tongue blade just to move your gums and tongue out of the way so I can see everything. I'm looking at your teeth, your gums, your tongue, your teeth, gums, yep. All right. Let's look around here. I'm gonna look down here. Teeth look normal. Gums, the oral mucosa is nice and pink. I'm gonna lift your tongue up. Yep. All right, and then can you open your mouth? Don't stick your tongue out, but say ah. I'm gonna stick this down just a little bit. Okay, wonderful. All right, everything looks normal there. The mucosa is nice and pink and moist. I was not able to see your tonsils, which is normal. Soft palate, hard palate, all looked good. Pharynx, everything looked normal in there. So I'm gonna check your lymph nodes.
Okay.
Is the last part. We have a lot of lymph nodes, so I'm gonna check different areas, and I'm just gonna name them as I do it. So I'm gonna check your pre-auricular. Okay. I'm gonna check your post-auricular. I'm gonna check your occipital, which is like behind your head here, like a massage.
Mm-hmm.
I'm gonna check your tonsillar and your submandibular. I'm gonna check your submental. All right, and then I'm gonna check your posterior, let's see here, no, posterior cervical and your anterior cervical. And then your clavicle, your supraclavicular and your infraclavicular, which is right under your clavicles. And I did not feel any palpable nodes, which is good. If I did feel like a heart, like your nodes that were enlarged or if they were tender, it would be a sign of maybe an infectious process. And that concludes our exam today.
Thank you.